A lot of
Hmm.
my audience members, yes, they're suffering from health related issues because of their, abnormal jaw structure, their small jaws. But a
Yep.
lot of them are also suffering from not liking the way they look because their jaws are narrow and or
Hmm.
recessed.
Yep.
Yeah, have you found that, and this is just anecdotal, have you found that patients that have more prominent jaw structure, fuller jaws, they tend to age better as a result of the bone sort of allowing the skin to have something to drape over as they age? Uh, is that something you've observed?
It's an interesting question. I would say just off the top of my head, I haven't really thought about it, but the answer is yes, because the bony architecture doesn't change as much. The soft tissues are what you know give us all the problems that we have at 70 that we didn't have when we were 50. I think the other thing that we're learning, and we learned this from facelift aesthetics, 40 years ago, or let's say 30 years ago, when you looked at God rest her soul, Joan Rivers, not to harsh on Joan Rivers, that classic like windswept look, everything was pulled so tight, nothing really moved. There wasn't a wrinkle within a mile of the face, but it just didn't quite look right, you know. And so what we've learned is it's not just the absence of wrinkles and the amount that you pull, but it's the vector of pull. So maybe what you need to do is kind of pull up and a little to the side so that things are where they're supposed to be, as opposed to just kind of like this, right? And then on top of that is volume in the right place. I have a cute 10-year-old daughter, and so you'll appreciate this as a dad. Now, she's got this little fold of skin under her eye, but you would never look at her and say she has an aged appearance at 10 years of age. But the point is that little plumpness is a sign of youth. And if you look at your pictures, or I look at my pictures when I was your age, and I look at them now, I can see this hollowness that I have here is because all of this fat used to be up here. And when you do that and you just do it on one side, you can almost see like the corner of the mouth goes up just a little bit. That big hollow there doesn't quite look as bad. And if you could imagine that this wrinkle would go away, that could look just a lot more youthful, right? And so, fat in the right places and volume in the right places with the skin draped appropriately on that skeletal foundation is critical. And to the point with the regenerative medicine and fat, what we're learning is that if you could use some of the regenerative capacity of the fat to make the skin actually look good. So on some of these really highfalutin plastic surgeons, not in the US because it's not like quote FDA approved yet, but when they cone down and take high resolution images of the skin on that 60-year-old woman that they did a facelift on 5 years ago, well, it's still 60-year-old skin, and so it has all the age marks and the fine little wrinkles. When they're doing their regenerative procedures now and they do those same high resolution images, that skin looks like the skin of a 20-year-old. So it's not only
Wow.
that things are now in the right place, but it doesn't look like you've been done. So
Right, right. That would be an argument in favor of fat grafting to add volume as opposed to bone grafting. This is an ongoing sort of debate in my space, which is, okay, if you want to build out the ramus and make the jawline look more prominent, do you add bone to the bone or do you add fat there? Dr. Michael Gunson, who is I interviewed recently, is a very prominent jaw surgeon in Los Angeles, says he likes to use bone to treat bony problems rather than fat to
Mhm.
treat bony problems. But I think you just made a point where fat could be better because of the regenerative properties of adding fat to an area. Um, do you have any response to that point about the pros and cons of adding a sort of a bony substance, in the cheeks or along the jawline as opposed to fat?
Yeah, yeah. I mean, I think it's an interesting point, and I generally actually agree with Dr. Gunson. I think you try to treat like with like. So if it's a bony problem, you can do that, but I don't think they're necessarily exclusive, right? In other
Mm-hmm.
words, I think like so many things, if you create a structural foundation onto which you can build the external foundation, uh, that works even better. And so the point I was making with these facelift patients is that and they now look so much better, like from a conversational distance. But if you got up close, it's still 60-year-old skin. Whereas with now the regenerative therapies, even that looks healthier, younger, more youthful. And so again, it's giving you that extra little bit of a positive result that you didn't know you needed. So I think it could be both.